Good afternoon, everyone, and thank you for joining Compass Virtual Health Center for our January Lunch and Learn. We are delighted to welcome Illinois-based schools, outpatient therapists, first responders, and behavioral health clinicians interested in increasing access to intensive levels of behavioral health care. I'm Kelly Stancato, Compass Virtual Health Center's Marketing and Events Manager. We have a fantastic lunch and learn plan for you today, addressing the topic of when to refer adults to PHP, IOP levels of care in a virtual setting. As Illinois' largest provider of psychiatric services and PHP, IOP levels of care, this is one of many community-based programs Compass Virtual will run for our community as we move into 2022. Please know that we will cover PHP, IOP is, and in particular, how Compass is able to drive through patient outcomes based on our comprehensive program. The presentation is designed to talk about when to refer to PHP, IOP, but also how virtual looks and works to engage adolescents and adults in a virtual setting. You will hear Compass's name over and over again, not because we are the only PHP, IOP program in the state, but because we believe our model is unique and outcomes driven and done really well in a virtual setting. A number of our future webinars will be CEU informational based and less Compass focused. Bear with us bear with our examples, but know that the knowledge of PHP IOP works in a virtual setting will hit home and come in handy when you're presented with a prospective student or patients in need of a higher level of care. A few housekeeping notes. All participants are in listen only mode. Please feel free to send us notes in the chat box below. As a follow-up to this meeting, we'll send a thank you note, and attached will be a checklist you can pin to your wall or save to your computer highlighting the key takeaways from this topic. Without further ado, let me introduce you to today's speakers, all clinicians of Compass Virtual Health Center. Taryn is the Senior Director of Virtual Programming here at Compass. Taryn has been at Compass since 2015 and has been a group therapist, a primary therapist, family therapist, and director before stepping into her current role as senior director. Taryn oversees the clinical teams and programs for adolescents and adults receiving virtual treatment. Taryn is excited to contribute to the expansion of mental health care options for underserved populations. Stacy is the director of our adult virtual programming here at Compass. Stacy has an extensive history assisting individuals with chronic mental illness in both inpatient and outpatient settings, as well as the community. She has managed a community support team which focuses on reducing recidivism, as well as having a role in expanding a first episode psychosis clinic. Her current role focuses on managing the daytime and evening IOP PHP programs in Compass. Her mission is to provide support and treatment to individuals with mental health diagnosis and help them navigate their life with their illness and support them on their road of healing and recovery. Natalie is the mental health resource and discharge planning adult therapist. Natalie has been at Compass since March 2021. Natalie was first on site in Chicago and then transitioned to the virtual program in September of 2021. Prior to joining Compass, Natalie spent over 11 years in community mental health. Natalie has supported individuals and families by providing therapy and connection to community-based needs. Natalie is eager to bring her experience to the virtual setting. Lee is an interdisciplinary artist, writer, and art therapist. Lee received a Master of Arts in Art Therapy and Counseling from the School of the Art Institute of Chicago. When pursuing her master's degree, she understood that her position as a student was where her activism was. To address issues of equity and difference within art therapy education at a PWI, Lee created Sister Circle in March of 2019. Her work is understood from Black feminist ecological thought and womanist performance pedagogy, centering the experiences, knowledge, and stories of Black women and girls. Lee has previously worked clinically with survivors of sexual assault, community violence, and supported families in navigating the child welfare. Lee currently works as a trauma-informed group therapist, supporting adults with intensive treatment for debilitating anxiety, depression, and other mental health concerns. Lee's current body of work that she is exploring is understanding grief, loss, and cycles of violence through using poetry, digital media, and memory as material to create an archival site as an avenue to process personal and collective experiences. And now I will pass it on over to Taryn to give us an overview about Compass.
Thanks, Kelly. Good afternoon, everyone. Thank you so much for taking time out of your day to join us, and welcome back. If you've been to a previous presentation or CEU of ours, we're so glad to have you. And if this is your first time with us, thanks for joining. I'm going to set the stage for the presentation today, and then I'm going to get out of the way so that you can hear from the rest of our amazing speakers. We want this to be both informative and immersive. And in the second half of the hour, you'll get to participate in a real art therapy skills group that we run with adults in our virtual program. I'd like to invite everyone to take a moment just to gather some basic art materials for the exercise. Basic materials could be a piece of paper, pen or pencil, colored pencils, highlighters or markers, anything that you have available at your desk works well. So as you heard already from Kelly, Compass Virtual is part of the broader Compass Health Center system, which has 3 on-the-ground locations serving Chicago and the surrounding metro area. We see 600 high-risk patients a day through partial hospitalization and intensive outpatient programming, which includes patients receiving care through our virtual model. Our virtual PHP and IOP serves both adolescents and adults who cannot travel to one of our sites or who simply prefer to receive their care virtually. Compass Virtual patients present with a variety of mental health concerns, including depression and anxiety, school refusal, trauma diagnoses, OCD, and substance use, just like those patients that visit our on-site locations. When I started working as a staff therapist at Compass in 2015, I never imagined that it would be possible for me to serve my patients virtually. And I had a really hard time even picturing what that would look like. I knew what we did in person, and thinking about translating that to a virtual setting was mind-boggling. We decided to develop our virtual programs actually in 2019, prior to the pandemic. And when we started planning for that, we knew that if we were going to do this well, we need to maintain our same high standards and high quality of care in the virtual space. Our virtual programs were adapted directly from the evidence-based on-site models that we use that we know are successful. We have continued to dedicate resources to this method of care because we found that our clinical outcomes for our virtual patients are just as robust as our in-person outcomes, and I'll elaborate on that a little further soon. So what is PHP and IOP? We are often asked this question about what partial hospitalization and intensive outpatient programming are, who our programs are designed to serve, and how impactful it really is to receive this type of intensive treatment virtually. Our hope is that by the end of this session, you'll be able to answer all 3 of those questions and have a really strong understanding of the typical experience that a virtual PHP or IOP patient has. So to dive right in, partial hospitalization and intensive outpatient programs provide a combination of therapy and psychiatric services to people who require more support than what they would get in a traditional outpatient setting, but do not need inpatient hospitalization or residential treatment to see a reduction in their symptoms. When a patient enrolls in a Compass Health Center PHP or IOP, they participate in skills-based group therapy sessions, individual sessions from a staff psychiatrist or nurse practitioner, and if they opt in to our weekly family therapy sessions, they will receive that type of treatment as well, all while maintaining their life at home. At the IOP level of care, they may also continue to work or attend school while receiving their treatment. And we'll expand on this in much more detail a little later in the presentation. So to summarize here, partial hospitalization and intensive outpatient programs can be considered ER and IPU avoidance programs that are focused on outstanding clinical outcomes and also on reduction in total cost of care on our overall healthcare system. So next, I'd like to elaborate a little on the impact that PHP and IOP can have on individuals and their communities. We launched Compass Virtual to address the shortage our state was facing in high quality, evidence-based treatment options at the PHP or IOP level of care. What does a treatment shortage look like for communities and individuals? Many of you have probably experienced this. It looks like long wait lists for your patients or clients who are looking to begin outpatient therapy or psychiatry or group treatment. and even a lack of available beds in the psychiatric wings of hospitals. Inability to route patients to the appropriate level of care contributes to worsening symptoms for those patients, and it also places undue stress on other systems within the community. We really see this in schools, hospitals, and outpatient therapy practices. And it's never been more important than right now to have an abundance of mental health treatment options available for everyone. According to NAMI, the National Alliance on Mental Illness, nearly 50% of the 60 million adults and children living with mental health conditions in the US go without any treatment. People who seek treatment must navigate a fragmented and costly system full of obstacles. And as a result, many people cannot access the comprehensive mental health care they need when they need it. So let's assume now you know how PHP and IOP programs can help patients and community systems, and you're eager to refer someone. But what if there aren't any high-quality, non-hospital-based options in your area? Do people really get better after attending intensive therapy in a virtual setting from their own homes? After almost 2 years of patients receiving their therapeutic and psychiatric treatment virtually in group programs and practices across the country, not only at Compass, we now know conclusively that clinical outcomes for virtual patients are indistinguishable from those in-person outcomes. This graphic illustrates our personal patient outcomes. So on the left, you can see virtual patients separated out from our overall Compass population. So our virtual patients at Compass at the time of discharge are reporting a 52% decrease in their depressive symptoms and a 48% decrease in their anxiety symptoms. This is compared to 46% and 44% decreases respectively when we view the average outcomes across all of our Compass locations. We continue to be so excited about dedicating time and resources to virtual PHP and IOP when we see data like this, because it tells us that it works and our patients are getting better. So at this time, I'm going to hand it over to Stacy, the director of our adult virtual programs. She's going to talk with you about the typical path of a patient and key indicators for referral to PHP and IOP.
Thanks, Taryn, and hello, everyone. As we've established, and many of you already know, the typical path for crisis level behavioral health in the US is complex and not always patient-centered. Let's take a look at Janet. She came to Compass frustrated with the lack of progress in outpatient therapy. Janet came in with presenting concerns that mimic what we see in typical virtual patients. She, like so many individuals seeking care, was placed on a long wait list to see a psychiatrist in her community. A month or so goes by. You can probably imagine what happened without more intensive behavioral health support. Janet's symptoms got worse. Of course they did. Her intrusive thoughts worsened. She stopped tending to her basic needs of showering, washing her clothes, eating. She had difficulty attending work and her responsibilities to the point that she needed to go on medical leave, and ultimately ended up on the inpatient unit after an ER assessment. This is a frustrating cycle to witness as a mental health professional, but the toll on the patient and the family is even worse. Janet and her partner didn't know that they had options for intensive behavioral health supports. They live in an area where the closest PHP treatment facility was over an hour drive each way. I'm sure many of you know this is truly an impossible but very real barrier for individuals that are parents, that are working, going to school, taking care of loved ones, that virtual treatment aims to solve. At the time, Janet thought she had two options: outpatient therapy that wasn't meeting her needs, or hospitalization. It probably felt like a dead end. Janet could have continued down this typical path that we see so frequently, and so many patients do get stuck in this perpetual cycle of a lack of appropriate treatment, leading to an escalation of symptoms, leading to another improper placement on an inpatient unit. When Janet came to Compass for a virtual intake, her path ended up being quite different. Janet had an intake scheduled at Compass and was admitted to her virtual PHP the very next day. Within 48 hours, she had a psychiatric evaluation by a prescriber on her treatment team, set individualized treatment goals, and began discharge planning discussions with her primary therapist. Collateral was obtained by her outpatient therapist, informing them that Janet started treatment with us. and her first family session was on the books. As she worked through PHP, she learned new ways of coping with her symptoms, how to manage her depression and anxiety without making poor decisions, and how to communicate a little better with her partner. Her outpatient therapist was looped into the communication on a regular basis to obtain important collateral and to also share Janet's treatment goals and progress. As Janet began to progress, it was time to step down to IOP. We worked together to facilitate a proper transition plan so she would have the best opportunity for success beyond treatment. She met with our resource and discharge planner to start the process of transitioning out of our care. It's important to us to make sure that patients transition out of care and back into the routine of their life. With Janet, we connected her with a psychiatrist that accepted her insurance. We explored support groups that she could attend when she wasn't in treatment, and explored additional outpatient providers that she can utilize in addition to her outpatient treatment team. We also submitted return to work forms that allowed Janet the ability to start working part-time and attend work on days she wasn't in treatment. During her days in treatment, she met with her team to review how she was adapting to work and what barriers she continued to face. Eventually, Janet returned to her referring outpatient therapist upon discharge and started to work full-time again. The average length of stay in the virtual PHP and IOP mimics what we would anticipate in person. Patients are generally in program between 6 to 8 weeks in total. PHP is typically indicated for about 2 to 4 weeks while a patient stabilizes and symptoms improve. An individual then steps down to IOP and would remain for an additional 3 to 4 weeks for skill reinforcement and for extra support during the transition back to school or work. Now, I want you to think about what to look for if you had a patient or even a loved one you're suspicious might need more support. At times, there's no question if someone needs virtual PHP IOP services. Many of you probably work with folks with these presenting concerns on a daily basis. When you're thinking about the need for a different level of care, you might consider the following indicators. Did this person recently discharge from an inpatient unit and is in need of aftercare? Is this person attending regular outpatient therapy but is still unable to function properly in their daily life? Have you noticed recent suicidal thoughts or self-harming statements? Does this individual live in a community without access to behavioral health care support? On the other hand, though, it's not always straightforward whether an individual should be referred to more intensive treatment. With your patient in mind, you might observe some of these warning signs. Is this person missing school or work frequently and often for unexplained absences? Have you noticed a change in their hygiene or appearance? Are they spending less time with friends and family or increasingly agitated? Has this person suddenly withdrawn from their hobbies or activities? Are you noticing big emotional outbursts that are disproportionate to the person's typical response? Has this patient's or student's academic performance suddenly declined? Is this individual experiencing extreme social anxiety, preventing them from engaging in the world? These are key to making an appropriate referral to any intensive behavioral health program. After the call today, we'll send out a one-pager with these specific details that you can keep and refer to as necessary. I also want to mention here that we're always a resource for you. If you have questions about the appropriateness of a specific referral, please contact one of us, and we would be happy to consult. We will also include contact information in that one-pager. I'll now hand it over to Natalie, who will discuss discharge and resource planning.
Thanks, Stacy. Now let's consider what happens when a patient is referred after meeting some of the criteria that Stacy just talked about. Any new patient receives a comprehensive evaluation with one of our clinical intake specialists to determine if they're appropriate for PHP or IOP level of care, and also if the virtual model could be a good fit. Treatment through Compass is a multi-layer approach that relies on a team of clinicians and a psychiatrist or a nurse practitioner to ensure that not only the patient is receiving appropriate treatment, but the family is getting the support they need as well. It all works together in a comprehensive and proven successful model. Like our in-person programs, the virtual model is comprised of group therapy, psychiatric treatment, family therapy, individual therapy, experiential therapy, and educational supports. Let's think about the patient Janet that Stacy spoke about earlier and what her experience in the virtual program looks like. After being admitted to PHP, Janet will join her peers every day from 9:30 a.m. to 2:45 p.m. to learn new coping skills presented in group therapy. All the skills she'll learn are foundational to the COMPASS program and rooted in evidence-based modalities, including CBT, DBT, ACT, and ERP. Janet will work with an individual therapist to apply the coping skills learned in group to her own symptoms and personal struggles. Janet has the option to participate in family therapy. If she opts in, she and her family will have weekly sessions with a family therapist who supports the full family system during treatment. That might mean, for example, focusing on improving communication at home and sharing information with family members about how best to support Janet. Within the first 2 days of program, Janet will meet with her prescribing doctor or psychiatric nurse practitioner for an evaluation and medication assessment. While in IOP, Janet will continue to meet with their treatment team regularly until she discharges from COMPASS and returns to her outpatient providers. Some patients come to COMPASS without an outpatient team, and we work diligently to provide those referrals during the first few weeks. It's important to our discharged patients have a strong outpatient support setup. Providers that can help reinforce skills and essentially keep their patients from coming back to COMPASS. COMPASS Comprehensive Virtual Model is one of the most, if not the most, robust PHP IOP programs out there. Here's a peek at the schedule for both adolescent and adult PHP and IOP. Evening IOP is offered from 4 to 7 p.m. You'll see there are several coping skills presented each day, time for mindfulness exercises, and experiential activities that might include art therapy, yoga, and movement. Our robust virtual programming is tailored to meet the needs of different ages across the lifespan. COMPASS started as a treatment option for mood anxiety disorders, and while that continues to be the foundation of our virtual model, we also have programming that's more age and population specific. On the adult side, we treat patients 18 and older with OCD and complex anxiety, panic, substance use, and trauma, as well as a more tailored support for young adults between the ages of 18 and 30. Resource services are offered to provide linkage to community supports, support for school, assistance in creating, maintaining structure, navigating job searching, and transition back to the workplace. On the adolescent side, in addition to mood and anxiety, we also provide the executive functioning skill and the academic supports mentioned earlier, and have plans to further differentiate the adolescent program in 2022. We find that age-based programming is the most important for patients to connect with peers who may share in similar struggles and situations. Processing through problems in a supported group environment with similar age peers allows for patients to not only relate to each other, but hear how others are using coping skills to manage their own symptoms. Remember Janet? She does not have an outpatient psychiatrist. Since discharge planning starts at admission to program, Janet's primary therapist refers her to the discharge therapist. The role of a discharge therapist is to provide support and connect patients to outpatient providers such as individual and family therapists, psychiatrists, and group therapy. A discharge planner will meet with Janet one-on-one to discuss her aftercare needs. They will provide support with outreaching providers and securing these appointments. The discharge therapist's goal is for Janet to have the best fit for aftercare providers and have an initial appointment prior to discharge to help support transition back to their outpatient team. We're always looking into building provider partnerships. If you're interested to be added to our referral list, please reach out to me, Natalie Pagan. I'm going to hand over to Lee now for a skills presentation.
Awesome. Thanks so much, Natalie. So I'm going to go ahead and get us into our art therapy portion of our programming today and like to ask, what is art therapy? When looking to create the art therapy virtual space at COMPASS, Essence Jackson-Jones, our licensed clinical professional counselor and registered art therapist here at COMPASS, wanted to focus on how can we create a space where it invites patients to nurture themselves. When we think about nurturing ourselves, it's not just about caring for ourselves, but also how do we challenge ourselves and how do we explore identity and how we look at our difficult things within our lives. Here at Compass, we explore different topics and concepts through our DBT, CBT, ACT, and ERP-focused curriculum. We wanted to develop an art therapy space where folks could dive deeper into these topics in a contained and nurturing way. So what is art therapy? When thinking about what art therapy is, I wanted to provide a definition so there's a collective understanding of what this treatment modality looks like at Compass. Art therapy is a mental health modality in which clients, facilitated by a trained art therapist, use art media, the creative process, and the resulting artwork to explore feelings, manage behavior and addiction, improve reality orientation, develop social skills, foster self-awareness and self-esteem, reduce depression and anxiety, reconcile emotional conflicts, and improve functioning and well-being. So as you see, there are so many areas within a patient's treatment plan that can be addressed and explored through our practice of art therapy. When thinking about the benefits of art therapy, we look at it being a place where self-expression is encouraged. So the art making process can serve as a healthy outlet for expressing and exploring feelings and fears. Sometimes it can be difficult to express complex emotions like sadness or anger with words. So art provides a medium to express and explore these intense feelings. Self-expression is a huge component of our virtual space here at Compass, and art therapy provides patients with the opportunity to practice having effective communication while expressing their feelings, wants, and needs. Another benefit is allowing folks to explore their sense of self. So the art making and creative process can improve self-esteem, it can increase self-awareness, and it can assist in building social and interpersonal skills. Art making also serves as a tool to assist in improvement in cognitive and sensory motor functioning. So this gives folks the opportunity to ask, what is impacting my self-esteem? How can I be more self-aware while practicing social and interpersonal skills through the process portion of our group? So patients have the opportunity to interact, they're able to witness other patients and what they're sharing, and then they're able to also ask questions about other folks' artwork and experience. The third benefit that I want to cover is that art gives an opportunity to express oneself through nonverbal communication. Art making and therapy encourages verbal and nonverbal communication, which strengthens connections between the left and right side of the brain. This is important when thinking about the brain's role in mental health and recovery. The fourth benefit is that there is a relief of stress. Various forms of art making have been found to effectively relieve stress and anxiety. Art making can also increase an individual's overall sense of well-being and build resiliency. So some patients at Compass actually come to our art therapy space specifically just to practice mindfulness and to reduce their anxiety and stress. The fifth benefit is our mind-body connection. Art making grounds patients in the here and now, and it can increase mindfulness, allowing individuals to access the right side of their brain, assessing thoughts, feelings, and traumatic memories in a different way that can promote healing. Art making can also release dopamine, which is a chemical in the brain that contributes to feelings of happiness. When thinking about the DBT model, one of the modules that we teach here, we guide patients in practicing mindfulness daily. Art making is just another extension and reinforcement of that mindfulness practice. As stated before, it gives patients the opportunities to access their thoughts, their feelings, their body sensations, and they're even able to reflect on their behavior, which provides more opportunity to incorporate the CBT framework. And our sixth benefit that I want to cover today is just the creative process in general. The creative process is involved in expressing oneself artistically, which can help people to resolve issues, reframe experience, and foster creative thinking and problem solving. The creative process can also assist in the development and management of behaviors and feelings. These are just 6 benefits that I'm naming, but there's so many more, but these are ones that we focus on here at Compass. So when we're thinking about our non-judgmental stance, this is something that we like to emphasize in our art therapy space, to have a non-judgmental stance. So how are we committing to being open to our artwork? Having a non-judgmental stance, radical acceptance, and being self-compassionate are values that are emphasized in our curriculum as a way to encourage patients to view and understand themselves and the world compassionately through their recovery process. The art therapy group gives patients real-time practice. There's an opportunity to reflect on, how am I talking about my art? How am I being open to the things that I have made? How am I learning from my explorations? So we encourage patients to center exploration and try not to cast judgment on the artwork being good or bad. We also talk about process versus product. Some folks, when they're presenting their artwork or how they use the art making time, they talk specifically about the art making process and what it was like for them. So I'm just going to give you a quick example. A patient may share, I was extremely anxious when I came to the art therapy space today, and I didn't know what I wanted to make. But I just focused on making art that would help me calm down. And I noticed as time went by, I became more relaxed. This is an example of a patient actively practicing self-regulation and one of our skills called ride the wave. And other patients might focus on the product. So when a patient is presenting on their product, an example might be, I created this image or symbol in order to reflect when I feel my most value-aligned self. We also want to encourage patients to be gentle with other people's art. So something that we like them to reflect on, a question is, how can we effectively communicate about what we heard and observed from other group members? How can we be gentle with our own art? How can we ask questions and avoid assumptions? And again, we love to emphasize being self-compassionate. Moving to developing an art practice. So when developing an art practice, we like to talk about and brainstorm with our patients around the question, what would my art practice look like here at Compass during programming? And what would it look like at home or in my community? We do this so that the work or the coping skills that are being practiced and explored during program can be developed and transferred to our patients' lives when they're engaging in their recovery process at home and after they have been discharged. We teach that an art practice can center our experiences, it can validate ourselves, challenge ourselves, aid in self-soothing, and it can also be used as a form of containment. So when we're looking at the style of art therapy we use at Compass, the art therapy space that we use for our treatment was designed by Essence, my co-collaborator. It fosters through an open studio style, a non-directive approach. So this just means a type of group art therapy in which no directives are given and you use whatever material you want. But we also do provide a directive just in case folks are not able to set an intention for themselves. So on the screen, you'll just see some examples of some artwork that could be made in the space. On the far right is just like an image of a collage. The top right is fiber material, and then the bottom right is a drawing. Patients also write poetry. They use digital media. We've had someone write raps and they perform it to the group after the art making process. Folks knit, and other people have also painted in our space, just to give you some ideas of how folks engage with the material. So now it's time for us to engage in the creative process. Before any art making, we guide the patients in how to set an intention. So we're gonna act as if we're setting an intention in this moment. So some statements you might consider before we get started. is I want to think about and explore. So maybe I want to think about and explore why I've been feeling so stressed lately. I am creating artwork to process. Maybe I want to process an argument that happened with my partner in the beginning of the week, or getting laid off of work. I am open to learning something about myself. I am not sure what I want to make, and I will not judge myself for what comes out of this art making time. So as a group in this webinar, we're going to take 3 minutes to engage in an art making process. I will play music during this time. If you have not already, please take a moment to grab your art materials. And when you're ready, you can begin with your art making process. We will copy and paste the suggestive directive into the chat, and I'll just walk through that really briefly. So if you are not able to set your own intention, you can focus on creating a piece of art that represents or explores your current support system. So what images, symbols come to mind as you reflect on your support system? How do you feel, or what does it look like when you are supported? What is challenging about receiving support? And what does it look like when you center your wants and your needs? So we'll just take some time right now to engage in the art making process for about 3 minutes. Awesome. So we're going to go ahead and wrap up our art making process. Thank you all so much for engaging in the process. You're welcome to continue making art during our questions and any feedback you have around what the experience was like for you. So normally in our actual groups at Compass, the patients have 40 minutes to make art. And then when we're about to finish up, I let them know there's no need to rush. You can just present on what you were able to get finished. Then we take about 30 minutes to process as a group. Patients are invited to either like hold up their art to the screen or they email them to the facilitators and we're able to share their art on our screen as well. But I'm just gonna open it up to any questions or any insights, maybe if folks had any insights in 3 minutes, but how is this for folks? Like how is it engaging with the music? How is it engaging with the materials? Were any new insights come up around the questions that I posed? And I'll just be looking at the chats to see what comes in and I can read it off to folks. We have some chats already. Folks are saying they love the music vibe and it's such a nice directive. Just gonna give folks a moment to put any comments. Yeah, so I have someone here saying, I like how guiding questions provided more support. And that's actually something that is big for our space because we do want folks to feel like they have agency to create whatever they want. But normally either myself or the other registered art therapist on site will come up with really intentional questions around what was presented in the curriculum that week. So say if we were having a group based off of values, I might come up with questions saying, what does your most value-aligned self look like? And sometimes people will do self-portraits. Sometimes folks will write a poem around like what their value-aligned self looks like. So thank you so much for that comment. I'm seeing very soothing and relaxing music. It made me want to stop thinking about my day and all that I have to do today. Another longer one here is like, as a fellow art therapist, it was nice to reflect on my own views of support system and how clients may view that. I like being able to go over the directives myself, and it helps me to connect with the clients. Yeah, that's such a great insight. We have a couple more messages here. Listening to the music can help distract thoughts that have the potential to prevent participation in the art therapy space. And that is so true. The playlist that we actually played is a playlist from YouTube and it's like meant for study and relaxation. But I noticed that having that music does help folks just focus on being present with their artwork and even sometimes their thoughts. Like sometimes folks do need to work through some of those thoughts through their artwork. Let me see. Music was very relaxing and not too distracting. Enjoyed the organic process of seeing what came out on the paper. That's interesting. And then love the vibe of the music. I guess a lot of folks are loving the music today. So any other questions? I see interesting process. For me, I flash back to 7th grade when I almost flunked art. All good now, but 61 years, not so much. Yeah, that is such a great comment. That comes up a lot in the space. Folks will like introduce themselves by saying, hi, my name is Lee. I'm not a good artist, just stick figures. And that's something that we actually challenge in the space of like, how are we speaking about ourselves and our abilities? And knowing that it's not about being a good artist or a bad artist, but it's just about engaging in the creative process. Thanks for bringing that up. And then the last one I will take here is it gave me a sense of calm, even though I'm still at work, gave me time not to think about all of my tasks. I love this activity. Very amazing process. All right, just for time's sake, I just wanted to thank you all for engaging in the process and also engaging in the discussion as well. That was really helpful. Thank you all so much. I will pass it over to Natalie.
So we're going to move along to our community connectedness. So if you guys didn't know, Compass boasts over 500 school partnerships and hundreds of referral partnerships with hospitals, residential treatment centers, primary care physicians, pediatricians, and outpatient therapists. Our goal is to be a resource and mesh in our community. There are a few ways that you can connect with us, including education and recs, clinical recs, hosting CEU webinars, staffing trainings in person and virtual, our newsletter, and social. So we're gonna hop into a Q&A now with Taryn, who'll be helping answer, and I know Taryn and others have been answering live in the chat as well. So we can see if we have any questions that haven't been answered. Let's see. We just got one. Taryn, do you have a substance abuse program?
That's a great question. We don't have a specific program right now in our virtual PHP IOP. However, we do offer what we call specialty groups. So once a week in our daytime adult programming and once a week in our evening adult programming, we have a substance use and addiction focused group. For the full duration of program, participants who opt in to that programming and are recommended by their clinical team can focus on substance specific skill building. And we also have several CADCs on staff that can work on substance goals with patients.
Lots of questions about our programs, Taryn. Also, people are asking, are your virtual programs offered to those who are uninsured?
We do accept self-pay. However, right now our insurance is limited to commercial insurance. We are working on establishing a Compass Foundation that would allow us to serve more patients that are uninsured or have different insurance plans that are not commercial. So more to come on that.
And then, do you think that virtual is a good fit for every patient with depression and anxiety?
Such a good question. And the answer to that is no. Just like any type of treatment, virtual care is not the right fit for everyone. Some things to consider when you are thinking about potentially referring someone or questioning whether virtual might be the right fit. Do they have a private space in their home? We do want to make sure that we're respecting everyone's confidentiality. So we do require patients to be in a private space, able to close the door and be alone in group. Does your patient really struggle with structure, and would they benefit from getting out of the house for treatment? That is something to think about as well. If they really need that extra support of getting up and going, virtual might not be the best fit for them.
Then we have another good one. Are the virtual services only available in Illinois?
Right now, they are only available to those who reside in Illinois. We are working on getting our clinicians licensed in other states, and we do allow patients to temporarily travel to other states while they're enrolled in our program, but they do have to be in Illinois for the majority of the time that they are in treatment, including on their first day of treatment.
And what signs should everyone be looking for when you're conducting virtual therapy and you begin to feel like virtual maybe just isn't the best approach?
Looking at engagement is something that we consider a lot. So are patients paying attention in group? Are they interacting with us? And are they making progress toward their treatment goals? This is something that we would be assessing for in person as well. Is the person responding to the interventions that we are presenting to them? And if we're not reaching them, if we're not being effective, one of the things that we do look at is the method of treatment. Is virtual right for them? Or would they be experiencing more progress in an on-site treatment facility?
Then is there any specific age range, and do we work in any way with schools?
Yes, so our virtual programs serve patients ages 13 and up. And in our adolescent programming, we partner with schools every step of the way. So we have a specific position on the Compass Adolescent team called an education specialist. And that person's focus is to work with the adolescent, their family, and the school to ensure that academic performance is maintained or improved while they're in our program, and that we are looking at what is the relationship between the mental health condition that this person is experiencing and how they're performing at school. And we also hold reentry meetings that have the education specialists as well as the clinical team, parents, and education team when the adolescent is ready to return to school.
We have time for a few more. Do we have a dual program for trauma and mood?
We have a similar model that I explained for the substance use program. So we have a trauma specialty group for our adults. So patients 18 and up once a week can attend a group that is focused on symptoms of trauma. And those skills are based on ACT and that treatment approach.
We have a question here asking if we screen for any sort of gambling disorder and or gaming disorder, and do we offer treatment?
We don't offer any specific treatment for gambling or gaming at this time. And if that is someone's primary disorder, we would refer them to a program that specializes in that.
So we have somebody who works for a mental health unit, and they're curious what the process is if they would like to refer a patient to the virtual PHP IOP once they discharge from the hospital.
Yeah, absolutely. So we can even conduct our intake assessments while the patient is still in the hospital. If they're able to use a laptop, we can have the assessment done while they are still inpatient. We also can do intake assessments over the phone if it's not possible to connect the patient via a laptop. And the social workers on the inpatient units will often assist in coordinating, just calling our front office and scheduling the intake assessment with the patient, setting them up with the phone or computer to do that assessment. But we've done that on several occasions.
Let's see here. We have a bunch of questions coming in, which is great. Let me see. Do we take referrals from psychiatrist offices for counseling services?
Yes, absolutely. So we hear from psychiatrists all the time referring patients, and that is a great way to connect someone with our services.
Then how do you manage safety issues virtually?
So for our adolescent programming, we require that an adult age 18 or older is home with the patient during group. So there's always someone available to them in the home. And for our adults, we manage it as we would manage any safety concerns that would come through to us after hours on site. So we have a detailed safety protocol. All of our clinicians are trained in de-escalation and contacting 911 if needed. And then we do have a paging service. So if our patients need to reach their psychiatrist outside of group time, they can contact our front office and page their provider.
This might be a question for Lee actually too. Somebody wrote in and wanted to know if you have any examples of patients participating in art making in non-traditional ways.
Yeah, I think I named one of them during the presentation, but even just like creating a rap. There was a participant who had like beats and would rap about their experience to the group. Another non-traditional way is someone made memes. I don't know if everyone knows what memes are, but they would make a meme and like pick a very funny image and then something about their symptoms they would kind of like focus on in the meme to kind of make light of something that they were working on. So I think like digital media is kind of like non-traditional and in-person therapy. I think like making raps is kind of non-traditional. And I think somebody else used to paint these wooden figures, and someone actually was using a 3D printer when I first got to Compass, and they would like print out these 3D figures and they would share them with the group. So those are just some examples of things that folks do in this space digitally.
Amazing. Thank you, Lee. And I think we're going to wrap up here with the Q&A. These are amazing questions. Thank you, guys. And any additional questions that you may have submitted that did not get answered by the panelists, we will have them answer via email. So we will be circling back on that. Again, thank you all for joining us today. We'll be sending out an email tomorrow to be used as a guide for when referring to PHP IOP in a virtual setting. Our next webinar will be on Thursday, February 24th, and the webinar will cover a similar topic of when to refer to an intensive behavioral health care in a virtual setting. However, this one will focus on the adolescent population. Please share this information with any colleagues or members of your networks that you think could benefit from learning more about this topic for adults, and we will send out a link to register in just a few weeks in February. And again, here's a list of our presenters. Feel free to jot down or screenshot their contact information, and we'll also include this in our follow-up email that you'll receive tomorrow. Thank you all again for joining us. This has been amazing, and we hope that we see you in February for our next webinar.
Thanks so much, everyone.
Thank you.
Thank you.